It's time now for Better Health. I'm joined here with Asante's health expert, Beth Coker, and Dr. Pratibha Seshadri, and we are talking about the Delta variant.
And Blakely, the CDC has reported this summer that we have seen a significant increase in COVID cases due to the Delta variant. So what is different and concerning about the Delta variant, Dr. Seshadri?
So the Delta variant is a variant of the novel coronavirus, first discovered in 2019. It has certain mutations that make it more transmissible. And people who have this, who are infected with this, have as much as 1,000 times more virus in their noses. So that makes it more transmissible and potentially renders slightly more severe outcomes. A common dictum we've started using in the hospital is younger, sicker, quicker. So just because of the sheer numbers getting infected, we see younger people getting sicker much quicker than last year when usually they'd come in at day 10 or so of illness.
And are unvaccinated people still our greatest concern due to the severity of the illness of this Delta variant?
Yes, the vaccines that we have, the mRNA as well as the Johnson & Johnson, have been shown to be still very protective in terms of preventing severe disease, severe outcomes, hospitalizations, and deaths. So over 90% of people we're seeing in the hospital are unvaccinated, unfortunately.
And how do you answer the question when people ask you what is better, the vaccine protection or natural immunity? Because you have people on both sides.
And that's a very good question. Honestly, the data and science on that is emerging. Just about 2 weeks ago, there was a very interesting study out of Israel that suggested that natural immunity is very durable. And the sweet spot seems to be someone who had COVID and developed natural immunity and then just got one dose of the Pfizer. They seem to be what the authors call sort of super immune, with very strong immunity against getting coronavirus infection again. So that's what we know right now. I suspect we will learn more about that group of individuals as to how long the immunity lasts. That's something we don't quite know yet, whether it's 3 months or 6 months. But I do plan to keep an eye on that evolving data.
Thank you. So the message to your patients is get the vaccine so that you don't suffer from the severity of the illness. Thank you so much.
Thank you. We'll be right back.